Was not.
We are live. I'd like to welcome my guest, Miss Irene Roper. For those of you who missed part one, I would suggest to you that you watch it after you watch this episode. And please feel free to share. Irene shared so authentically about her journey with diabetes, and tonight we'll be sharing about her kidney transplant experience. Irene, please introduce yourself to the viewers.
Good evening, everybody on the podcast. My name is Irene Roper. I am a past student of Titchfield and a past teacher of English, where I spent some 20 odd years at Titchfield. I migrated to the United States and went back to college to do medical. Trained medical assistant, phlebotomist, and ECG technician. Um, the journey, like in part one, if I have to give a brief synopsis, we delve into diabetes, the causes, and all the things that can happen. For those of you who did not get to watch this yet, it's a disease characterized by the inability of the body to process starches and sugar, which gives the body energy. And so the pancreas is the organ of the body that produces insulin and allows the body to break down the sugars and starch into energy and cause the body to process this because it's the sugar and starch that gives the body energy. So it's very, very, very important. When the pancreas is unable to function optimally, then we started having problems. And so that is what causes the inability of the body either to produce the insulin or absorb the starches and sugar and better utilize it. So some
Thank
of
you for
the
sharing that.
huh?
I said, thank you for sharing that. Thank you for that recap. I do appreciate that. And
Yes, so constant thirst, constant urination, dry
yes,
mouth, feeling hungry and thirsty. You know, the body is constantly craving liquid or water, and you're constantly hungry. So, you know, if any of these things are happening to you, then also very important if you have a wound that's not healing quickly. So these are some of the signs that you could look out for.
I appreciate you sharing that. And I'd like to say to the viewers, please say hello. Let us know that you're there. And if you have any questions, please feel free to post them. So I'd like to ask you, Irene, to please describe how you felt when you were told that you needed a kidney transplant.
I was devastated because I pay very close attention to my body. Being in the medical field, there's your insight is heightened because you know what can happen. I was seeing a nephrologist, so it is being a diabetic, the parts of the body that are affected are your kidneys, your eyes, your feet because of the neuropathy, your eyes because retinopathy, and the pancreas is the organ I mentioned earlier on that produces the insulin, and the insulin is cause the body to process the starches and sugar. And being Caribbean, some of us, we have sweet tooth, and our main staple in the diet is carbohydrates.
Yes, yes.
And I mean, having grown up on this, we tend to be partial towards having too much
Yes.
carbohydrate.
How important was it to have the support of family and friends during this time?
It is essential to have a good support system. Sometimes it is not so much what is happening, but how the mind plays out. You need support, and I was fortunate enough. Well, I'm from a very big family, 7 girls, and three of them are nurses. I also had the benefit of my colleagues, some of which are doctors and nurses, my all my doctors, especially my nephrologist, Dr. Cyril. Um, the family had to be there because you have to be constantly going to the doctor. Once you are given the diagnosis, then there is preparation. There is preparation. You're signed up for transplant immediately. You are taught like classroom how to live with this disease, and how to take care, how to choose wisely which dialysis. And you are given tons of information. You meet on a regular basis. You go in and have classes on a regular basis in like a classroom setting. So you are prepared. Somebody has to be there to take you to these you it's not just, you are not just given the information by yourself. The next of kin or your caregiver, in my case my sister, who is a nursing educator, she is the proxy. My husband went to all of the appointments because he has to be knowledgeable in
Yeah.
terms of what is happening, how to give you the medication, what will happen if you faint, or he has to be there because he's the one in the house with me on a day-to-day basis.
Okay.
So the family is very important because people sometimes, I find this can be so debilitating that people just give up. They give up
Yes.
because of how they feel.
Yes.
This is so tiring, and it affects your entire life, the
Yes.
changes you have to make. So it becomes a burden, and if you're not careful, you go into depression.
That is definitely understandable. Hello, Maxine. Thank you for joining us. We really appreciate it.
Maxine
Did
is
you?
one of your loyal
Yes,
listeners.
Maxine is such a dear friend. Did you have to do anything to prepare your body for this major surgery?
Yes, you do, and that is rigorous. It takes a toll on you. Bri, I remember one day I gave 30 odd tubes of blood
Mm.
to sit down there and literally
Oh,
watch. I'm luckily for me, I'm not scared of needles, being a phlebotomist. And
yes,
but just to sit and watch your blood coming out, and 30. There are times when it feels like no more is coming. They have to use
yes,
more than one sites and all of that. I had to do a full CT scan. I had to do EKG. I had to do the stress test. I had to do a full heart workup. Just every system of the body. I had to do a colonoscopy. I had to do chest X-ray and ultrasound. The entire 9 yard. Every system of the body had to be checked to ensure that you are okay to undergo that procedure. Then what made this even bittersweet, the family members being diabetic, we inherited this from our mother. My mom is severely diabetic. My grandmother, as I told you before, died
Yes.
from diabetes. My sister, my brother, I have a brother who died from complications at Port Antonio hospital, and so the family could not be a donor, and any of them, they had too many health issues going on, and out of the blue, my husband was an exact match,
Wow.
which is a miracle, to begin with. So after the preparation and everything, they kept it. As a matter of fact, one of the nurses asked if he was coerced into doing it. Although he's my spouse, not even my phone number could go on his in his medical record, and they had to make sure. So I said, "Did you do you know that I've been married to this man for 20 odd years? Why would he allow me to coerce him?" Anyway,
I think
uh,
it speaks volumes about his love for you as his wife.
I don't even question that anymore. My husband had to be sent from God for me.
Oh, wow.
It had to be. I mean, having gone through all he has been through, like a friend was here today with me, a very dear friend, and he said, he reminded me that you are a miracle. And
Yes.
here is a person who was spent the night with his wife in the hospital with me until daylight when I did the surgery.
Oh, my goodness.
They slept in the room, he and his wife, with me because was there for, most of the night, but he didn't stay the entire night because he had to work the next day.
Okay.
My sisters, more than one of them, were there with me way into the night until the surgery was a breeze, I tell you. I was not even sure they did it. I thought
Oh,
something went
wow.
wrong. I woke up immediately and I said, "Are you sure they did anything? I don't feel anything, nothing at all."
Yeah.
And he said, "Feel your abdomen." And I realized that the entire thing was bandaged. But as to, I have done several surgeries, too many to count. And I did not feel even like I got anesthetic. I
You are a blessed woman. I've had two C-sections and I can promise you I felt it after. So, wow, that's
I
pretty
don't
amazing.
have children, but I see my sister who did the C-section, and I saw the cuts on my abdomen is bigger than a C-section
Oh my goodness.
because it's a cross and down. I don't know if you are aware of it, but when you get a kidney transplant, they don't remove the bad kidneys, and the kidney is no longer placed in your back where it is originally. It is placed in your abdomen. And then to add all of that in context, I got the kidney of a very huge person. So I got a big kidney, a 6 foot person, very big man. So
What
it
you
is.
just you just taught me something because you see the shock on my face. I did not know that. Maxine said, "Blessings to you, Irene. You are a very strong woman." And Maxine, I do agree with that.
Maxine, You have to be strong when strong is the only thing you can do. You have to.
Yes.
Because the thing is, just this week, somebody I know died from dialysis.
Oh, wow.
And I have after I did the home dialysis, and that nearly killed me. You haven't heard anything yet. I'm gonna tell you things that is gonna make your mouth drop this evening. Um, I have been to the center where today you're there with and tomorrow you go and somebody is missing and you ask what happened and they just died. I have been in the center with people whose body reject the kidney. Nothing they did. Once you get a transplant, you have to be on anti-rejection medication for the rest of your life. And even after several years, and any little thing that happens to the body with that involve bacteria or anything like that could get in the bloodstream, get to the kidney, and the body just rejects it. So there are people who have gotten transplant 3 times.
Oh my goodness. That is, oh my gosh. You're teaching me, Irene, because I did not know that was possible. Let me ask you this. Was it a very emotional time for you? I mean, I know it must have been overwhelming, but did you find yourself on an emotional roller coaster?
No, no. My faith, I think, and I belong to a church that they are extended family. They, when I tell you that it is not just religion, they care for you. They care for you. I remember my pastor's dad is in a wheelchair. He's in a wheelchair. And I remember once I was in the hospital being transferred to some place else. And the ambulance was downstairs waiting on me. And they were at the door. And I wondered, like, I mean, what is going on? They came just to see me and to pray with me. And the nurse is saying they're ready for her. um, it's unfortunate that they're here, but we can't make the ambulance waiting. An ambulance is in need. They're in need of
Yes.
it at every minute of the day. And somebody else come and said, no, they're here to see her. Let the ambulance wait. And they came in and prayed with me. So
Oh,
it
wow.
was just like a touch and go. They weren't sure they could do it. They're not sure, but like a doctor from church, not, I mean, it's a church where you're closer to some people than others.
Yes.
Some people you're close to, and some, you see them and they, whatever, but you're not as close to those. And like after the surgery, one that is very close to me personally, a lady, she was in the hospital with me the night I did the surgery. She was there, but this other doctor was there. And like I had just done the surgery, so the draining and the blood, and I'm whatever. So I kind of didn't want her to be, like, I mean, the state I'm in, if you
Yes, I
understand.
get it.
And she said, I knew she was a doctor. I mean, what kind of doctor, I wasn't sure. But she's like, I'm getting up to go to the bathroom, and the blood and everything and all of that, you know how you feel at that point. And she
Yes.
said, come and let me take care of you in the bathroom. And like, I didn't say no, but I think my face showed I'm not ready for that.
Yes.
and, and she said, come on and let me take care of you. Come, Grace. And they took me to the bathroom and cleaned me up and what have you. And she said, like today, she is so close to me. But, if like I'm telling you the support that I got was like, it touched my heart. It touched
What
my
a
heart in a
blessing.
special way.
What that is a blessing, and it makes me think of those who don't have the support. Like, how difficult must it be for them not to have anyone to lean on?
For those of us who have that kind of, like I said, it's seven sisters of us. So, sometimes even I have a little brother. Brothers are brothers. But
Yes.
they took turns to stay when I was in the hospital, not for the transplant, for something else. And I would, somebody would be there for some parts of the day, and then I probably fall asleep. And I know what time Glenn would leave work and come and stay with me until I fall asleep. And then, I sometimes have no idea when he leaves, but he
Okay.
was there on a daily basis. And I would wake up and my brother would be there, my little brother would be there, and I would fall asleep and wake up, and it's somebody else. So the fact that I was there for a while, they took turns to just be there with me, so I was never alone. And something brief, even the nurses. I taught at a college medical, and somebody said, "Why you look so familiar?" And I'm saying, "I'm looking at you and realize that, well, only to realize that somewhere along the line I taught this person.
Oh my goodness.
I taught this person. That
Oh
my
my.
nephrologist was there. I did my surgery in COVID. Just when the lockdown was about to start. And he came every day and he said, "Send her home. I don't want anything to happen to her. Send her home." So I did my surgery just as the lockdown was going on. And all the trips, after I did my surgery, I had to be there every other day, then every twice or so for the week, then every week, then every other week, then every 2 weeks, and it went just like that forevermore because I should be in the hospital, but with COVID,
Because of COVID, yes.
yes, I had to take my chances, and I tell you, nothing happened to me. Nothing happened.
That is such a blessing. That is such a blessing. Hi, Mikey. Thank you for joining us. We appreciate you. I have to ask you, Irene, how long was the surgery?
The surgery was about 2 hours, I believe, because I woke up very quickly.
Okay. Okay.
If
Okay.
I or if it was like my husband, it would have been longer because then two of us would go under.
Okay.
They
Okay.
would have to take it from him and give to me, but his whatever didn't work out. Last minute he developed such high blood pressure. I think
Okay.
he was just thinking that both of us gonna be laid up for whatever. So maybe that was just God intervening,
Yes. Yes.
you know.
Yes. Yes.
Because
Yes.
eventually I got one, and shorter time
But
and all of that.
just knowing that he was willing to do that for you, I'm sure, is just as good as if you did get his kidney. I mean, I can't think. Listen, I know a lot of husbands would be happy to do that for their wives, but I know there are some who they definitely wouldn't do it. Let's be honest. So
He
you're
would do
married to a very
anything.
special man.
He would do anything for me. I'm telling you that.
That is that is so beautiful. Mikey says, I was in this beautiful ladies class at Titchfield. Much
Really?
blessings up to her. Mikey, yes. Yes.
That's Mikey Green? No,
Mikey,
Mikey Go.
Mikey Go, yes.
Oh,
Mikey
okay,
Go, yes.
okay.
Yes. So I have to ask you, how long was the recovery time and how was it a tough process?
Bree, when you're going to do surgery, you're given all the information, good, bad, indifferent. You know, this is what is going to happen. This may happen. That may happen. I am telling you, I had like a 7-inch cut and maybe an 8, one across, one down. And I had in over 38 um, staples. I had in like a plug. Something was in there's a drainage and there was something else. And like when the drainage is to come out, I'm asked, is this gonna be painful? Whatever. And they took it out and I was like, oh my God. I didn't even feel it. They
Wow.
took out the staples. I'm thinking staples, metal staples in you over 38. And they took them alternately. One, then skip one, then another one, skip one, another one. If I told you that that went like a breeze, you're not even going to believe me because I was shocked. I'm saying they're pulling out a staple out of you and you're not going to feel it. It's not going to hurt like crazy, but it didn't.
You are so blessed. I remember them taking my staples out after my C-section. There was one that got in the wrong way, and I tell you, I remember the tears when they finally got it out. So, I mean, you are a blessed woman, Irene. I can't describe it any other way.
I am asking all the people, how is this gonna go? Is it gonna hurt? All the nurses, all the doctors. And like some of them are joking, but some of them are saying, yes, there is a little, people are different, what have you. But I was shocked. Everything went so smoothly. Just a little part wouldn't heal for a while,
Okay.
and that's normal. That's normal. It took a little longer than whatever because it wasn't closed properly. It
Okay.
wasn't closed to begin with properly, so fluid was coming out from that. But apart
Okay.
from that, so that took a little longer, and you had to be septic. Everything had to be very, very clean. No,
Yes.
nothing, whatever. But nothing happened untoward. Nothing
Okay.
happened like that. So in like 3, 4 months, I was okay. I walked in the hospital after I did my surgery while I
Oh
was
my
still there.
goodness.
So it's not like, this was something that, I saw my sister walk with her C-section and it was painful as hell.
Oh my goodness. I have to ask you, how did the transplant affect your quality of life?
It did affect it. For one, I couldn't work.
Okay.
So that was a big, part of the salary going away, and I got good salary. I taught at a college. So,
Yes.
that was good. So I was considered once I went on dialysis, they call it disability. So you get a little bit of stipend, whatever. Not enough even to buy medication.
Okay.
Because it's not disability, whatever.
Right, right, right.
And I couldn't do a lot of the strenuous things, clean the bathroom. No, definitely not. Um, like a whole lot of the housework I had to get help with. Um, I am outgoing. I'm very outgoing. I will, I'll go out and I have a good time and I dance my feet off and all of that. That had to be restricted. I love vacationing all over the place. I had to put no more cruise, anything involving walking a lot, or anything strenuous was a bit too much. So the part that was different was the fact that, and another thing, I almost live at the hospital. When I tell you that even now, for the past 3 weeks, I've been to the hospital like maybe 5 times, because there is a very, very thin balance between, like, medication too low or too high, and
Okay.
it just goes off rail for no apparent reason.
Okay.
So another thing is the anti-rejection has to be at a certain level,
Okay.
because that can affect the body, you know, significantly. So it was high, so we had to modify the medication. Then I had to go back and test, and then I'm waiting on result maybe tomorrow. If it's too low, then we go back up and raise the medication. So it is a delicate balance that we have to maintain. And
Okay.
I had to see the doctors on a regular basis. Cleaning my teeth is not done every 6 months, it's done every 3 months, because they fear if you have anything and there's bacteria in the mouth or any little thing with the gums, it can go in the bloodstream, it will affect the kidneys. The
Okay.
eye, I told you already that I get injections in the eyes.
Yes.
So you have to, you have to be at the doctor on a regular basis. The heart, I had congestive heart failure already, so I have to be very, very careful with the heart. I probably tell you this very quickly, it doesn't relate to the question, but when I, like I said, once they tell you that this is transplant or dialysis, you get lots of education and you
Yes.
make the choice. I figure that the home dialysis would have been easier because you could do it at night and you could do it every day, So if you're doing it at night, I could still work and come home and do whatever, because it's done at night in your sleep. Sometimes you even can sleep with it, and then go to work, even for a couple of hours. I nearly died with that.
Oh my
The
goodness.
thing, the peritoneal dialysis is where they put fluid in the body, and between the peritoneal cavity, that's between the skin and the organs. There's a cavity there. And by osmosis, it pulls out the toxin out of the body and leak it out. So you don't have to do the dialysis involving blood. The toxins are released into that liquid. They put a whole lot of how much liters of fluid in you. Special fluid, of course, that pulls out the toxin and releases it. And I could do that at home. You get a machine that is
Yes.
preset. So all
Okay.
you have to do is just put in a few details and do what they tell you to do. Brain fluid was being kept back in the body and surrounded the heart and the lung. So I'm at work, and I don't feel, peritoneal dialysis has its ups and
Yes.
downs. And I'm wondering what is going on. I don't feel right. But it's nothing that is going to kill you, if you get what I mean. You have good days, you have bad days. Anyway, I'm at work, and it was finals. So I'm doing I gave them the exam. I'm marking the papers. One of the students looked at me and said, I don't like how you look. And I said to her, as a matter of fact, I'm not feeling too, whatever, 100. And she just ran. And she went to the dean and said, I'm not well. And he came and said, what is going on? He didn't. My supervisor is a nurse. So she came in, and I told her what I feel, how I'm feeling. And I told her to give me some oxygen. It's a medical
Yes.
campus, so whatever. She gave me, but I still didn't. I felt better, but not 100% better. So I'm there and I'm walking and I'm feeling, no, this is not good how I'm feeling. So I said to her that I drove down there on the highway.
Oh my goodness.
I said to her, um, I want to go to the emergency room. So I called my husband and I told him to bring my insurance card and make arrangement to pick up the vehicle. And I'm going. I wasn't feeling well, and I'm going. So I said to her, I left like my handbag and whatever with her to give to my husband when he comes, because I spoke to him.
Yes.
Bree, I said to the station for the thing is we can see it from work, so it's not gonna take 5 minutes to reach. I told her to call the ambulance. She called the ambulance and I went in. And the minute the door was closed, I coded.
Oh my goodness.
I heard the door lock, and that was the last thing I heard. Bree, for 12 minutes, immediately they took me to the hospital. For 12 minutes, they're pumping my chest, trying to revive me.
Goodness.
Um, my husband, a whole lot of things happened very quickly. They put something in to check the blood vessels, and they check the heart. All this time, it's a fluid around the heart and in the lung area that is making me unable to breathe, and that's what
Yes.
caused the whatever. So I was in a coma for 5 days.
Oh my goodness.
Nobody is sure whether I'm on a breathing machine. Nobody is sure whether I'm going to wake up. Everybody, my sisters in Jamaica, two were there at the time, and they came up because nobody was sure what was going to happen. Everybody is in the room day after day. This happened on a Friday, and the Tuesday I am waking up thinking it's Friday evening. And I'm seeing people I'm not supposed to be seeing. A whole lot of people in the room. My nephew, my nieces, sisters from Jamaica. So I said, I awoke when they took out what. Well, I suppose I was awoken before they took it out because they couldn't take it out before that. So they took it out. I'm conscious. So I said, somebody asked me if I knew where I was, and I said yes. But the voice is hardly there because this thing was in the throat. Um, Quickly, I realized, I said, give me a pen and paper. And I asked what day it is, and I was told Tuesday. Friday, Saturday, Sunday, Monday, Tuesday.
Oh
5 days.
my goodness. Oh my goodness.
When that was even worse than the transplant. They had to test me till thy kingdom come to find out if I had neurological problems. They had to, I had to go back to learn how to walk. I went to rehab to learn how to walk, learn how to drive, to push a trolley, to what made them know you're ready to go home if you can wash your hair, have a bath by yourself, and put on your socks and shoes and clothes. So I stayed for about 2 weeks, and I came home with a walker in a wheelchair, a walker and in a wheelchair. The house we live in is 2 story, and the bedrooms are upstairs. How was I going to function? with a walker up the stairs or in a wheelchair up the stairs.
Yeah.
And I came out with every professional you can think of. Uh, Speech therapist, um, physical therapist, all manner of whatever. Brie, I did not use that wheelchair for a day. I told myself, whatever I am doing, I am not going in the wheelchair. So I gave it away. I never used the walker either.
Oh, you are a strong lady.
And I don't think anything happened to intellectually because, I was tested for a long time and
Yes.
they said no, nothing happened.
Before we went live, you were talking about the things that damage the kidney. I'd like you to talk about that, to remind the viewers.
Okay,
No, please do.
okay, one of the things that damage the kidney is medication, alcohol, um, ensuring that you do constant blood tests and get your CHF, your kidney function. The kidney function is very, very important. And ensure that you see if you are diabetic or if you're hypertensive. These are reasons. And ensure that whatever medication you are getting is not going to affect the kidney in any way, shape, or form. That is because people go on dialysis if they're diabetic or if they're hypertensive. And hypertension is a silent disease. You can be hypertensive and don't know.
Yes.
And ensure that the medications you are given are not going to damage the kidneys.
You have to be your own advocate. So when you're given a prescription, would you say, Irene, that it's good to do some research on what you're taking
Well,
so you're aware what it's doing to the body?
you need to read the side effects. The side effects are very, very important. And another thing you will need to ask the doctor or the pharmacist. Whenever you go to the pharmacist, they ask you, do you have any questions? Ask as many questions as you feel like asking. If you're not getting it there, then go to your computer, go to WebMD, call up somebody, talk to the doctor. Sometimes these doctors schedule patients so close together that they hardly have time to explain. And another thing is a fact, the drug reps, the doctors sometimes don't know the medication.
Wow.
They're not going to know all medication. They know the classification of the medication, but they don't sometimes don't know what it interact with. This
Yes.
you're taking this and you're taking that and you're taking whatever. Sometimes it's a drug rep that come and spend 15 minutes with them and tell them, push this one, whatever. They are not going to tell you all the side effects. It is incumbent upon you to make sure that you do your research. Do
Yes.
your research. Because
That's
once the kidneys
important.
are damaged, if it's not dialysis, and another thing, it is so expensive. The dialysis and the transplant and everything else is so expensive. So you have to make sure you do your due diligence.
My goodness. So I have to ask you, what do you do on a daily basis to make sure that your kidney remains healthy? Is there anything in particular that you have to do on a daily
Well,
basis?
you are told what things not to eat. Some foods you can't eat. Turmeric, curry, pomegranate. Um, they'll tell you ginger. You
Oh,
can't
wow.
have, no, you can't have those. Also, you have to limit your intake depending on the medications you take. Things like coconut water, you have to be careful with because it has a whole lot of potassium.
Okay.
You also, I have to take constant blood tests because that's the only way they're going to know what is going on in the body, the kidney function. This new kidney you have, I've had it for 3 years, Brie, and
Okay.
over 3 years, and I've never been to the doctor for it.
Wow.
I have never gotten an infection.
Good.
So
Good.
it means you have to keep everything sterile. That's one of the things you have to make sure everything is sterile. You have to visit all the doctors. All your doctors visit if it's even every week. You have to take your medication, and medication is taken on time. If they say 5 o'clock, it's 5 o'clock. If they say 9 o'clock, it's 9 o'clock, because the time frame in which you take the medication can make a difference. So those are some, and oh, I take a whole lot of medication, Brie. If and insulin. I take insulin, so that's it.
Okay.
And mine is in a pen with a needle.
Okay.
So
Okay.
and I test every single day.
Okay. Okay. Mike, he just said the things that you mentioned that you can't have anymore. He said, I love all of the things that you named. And when you said ginger, I was surprised. I'm not, especially when you said ginger, I was really surprised at that.
Well, what you have to know, you see, these things affect some of the medication. And if it's
Okay.
going to
Okay.
affect the medication, then it doesn't even make sense. You're playing with your life.
Okay. Okay. So it wouldn't be worth the risk. Are you able to exercise? Can you go for walks or anything
I
like that?
can go for walks, but I get tired very easily. I get
Okay.
tired very easily. Another thing is, I'm telling you, is your choice of clothes, Breathe.
Wow.
Because the kidney is in the front of me, in the abdomen, it means nothing close, because
Yes.
this is not natural for
Yes.
that protrusion right there.
Okay.
It sits on the right.
Okay.
So your choice of clothes, and I mean, you can feel it. It's heavy. It is heavy.
Oh my goodness. Oh
So
my
walk,
goodness.
you walk, of course, but after a couple rounds, you start feeling
You
this
feel it.
thing is kind of pulling you down. So the constant going to the doctor, the constant checking up, and then all the other systems, the eye, the teeth, the feet, all of that in tandem. You have to make sure everything is in order. So you have to watch what you eat. You have to drink a whole lot of water. Whole lot, 4 or 5 bottles a day.
Okay.
You have to watch what you eat, like a hawk. You have to watch what you eat. You still, although you're doing all of that, you still can't consume a whole lot of carbohydrates or sugar, so
Okay.
the cake and the sweets and the this and the that and all of that. Also, if the sugar goes down too low, you have what, hypoglycemia, where you're unconscious. And if you are not someone who know what to do immediately, every time that happens, you have to go to the doctor, call an ambulance or something like that. It has happened to me on very, very few occasions, but everybody knows what to do. So the
Okay.
first thing you do is you get, if you anything sweet, and this is when it is below, the sugar level can go 40 and below.
Okay.
Once it is in the 50-40, you have to be very careful what happens. So you get eight ounces of orange juice. Anything sweet like honey. If you have natural glucose, you can take it. They have tablets. You can buy the tablets and take. The thing though is that you have to be so careful, because when this happens is as if you're not aware of anything. So swallowing might be a problem, um, because you're not aware. You're kind of out,
Yes.
as if you're fainted.
Right.
Um, Once you get the 8 ounces of orange juice, natural orange juice, anything sweet like honey, agave, things like that, um, can bring it up. The doctor's office even have some candies that they can give to you, and you can, like I said, you can buy glucose tablets. If you
Okay.
buy the raw glucose, you can just have it like that. Um, that those things can help. If you don't know what to do, call 911.
It's better to. I have a couple comments here. Sonia says, "Thanks, Irene, for sharing your journey." And Maxine says, "I really love how you tell it like it is, Irene, straight up. You have opened my eyes to so many things. Thank you for sharing your journey and educating us about your illness." And these are the calls and comments that I have received. I mean, the gratitude for how you shared so authentically, because I'm telling you, it got a lot of us thinking. I'm listening to you and you talked about, like, cruising and things like that. I love cruises. And, I have to ask you, do you miss how your life was before? Do you miss teaching? Do you miss the freedom to go on vacations and just live your life like you used to?
I am going to tell you that I miss it sometimes, of course. I'm only
Yes.
human, and like I said, I am the person who, it's just my husband and myself. So we pick up ourselves and we go on here and we go on there and we go on all over the place. Vacation is a must.
Yes.
Um, I miss that, of course, but then when you think about your life, and this is a second chance, literally it is.
Yes.
There are other things you can do, enjoy doing, and you're happy for it. Like I said, just today, somebody was reminding me that, you are a walking, the doctor who saw me just after I faint, I coded, told my husband that it has to be a miracle that I'm alive.
Yes.
And when I tell you that, I'm not joking when I say that. If you are told, call everybody who need to come, let them come, because we're not sure what's going to happen.
Yes. Oh my, I have to ask you, how thankful are you for the gift of life?
I am, Brie, I do, one of the things it has done, I am a Christian. I'm a Christian, baptized, what have you, go to church, very, very active. And it has, you know, strengthened my faith some more. Like, oh, I didn't tell you this part, and I'm not gonna
Go ahead.
elaborate.
We're in no rush. Go ahead. Feel free to share.
When I woke up, I had distinct, clear memory of going to heaven.
Wow.
I walked around. I mean, the things I remember are so poignant. It's seared in my brain. But I came back, and in my own self, I didn't want to.
Yes.
Like I just saw a part. I am conscious of where I am and what is happening. And it's not well, it had to be a dream, but it was so vivid,
Right.
very, very, very vivid. Like the tall columns,
Yeah.
what's on them, and all of that. What I saw. So I know that there had to be some you know unnatural whatever that was going on there. Like I could have died.
Yes.
I could have died, or I was close to, but whatever happens,
Oh
uh,
my
it
goodness.
has cement. And like I'm saying, so many things in all of the whatever I remember. It's like, you are close to the edge, and it's just like God showed up, and things are back to normal. One of the surgeries I had to do, um was in the whole what fiasco with my being in the hospital, and my husband basically operating on fumes. Every day he had to be at the hospital. Something happened with the insurance, and I lost it. It wasn't paid on time, whatever happened. And this I'm to do a surgery, and the doctor told my husband, well, told both of us, if
Mhm.
you don't have the money up front, we can't do it. We can't do this thing. um the surgery alone was something like 8,000. They had to have a surgeon and an assistant, two anesthesiologists, and the place they're doing it in is charging separately. And um, it's, you have to have the surgery. You have to. This is not elective. This is emergency.
Right.
And Bree, I got the money, and I'm ready for the surgery, and I don't know what happened. The doctor didn't take the money that day, or nobody, whatever. We had to have the money to go,
Yes.
but somehow during all of that, nobody took it. And after that, something else came up, and the disability kicked in. And once the disability kicked in, they are paying back for some things. Bree, the insurance had a whole year missing from it. So they signed it and what have you. And I fought with them for like nearly 9 months to correct it. And every time I go, it's the same foolishness. It's the same foolishness. No matter what I tell them, they give me documents to read, whatever. It isn't that. And on the last of it, somebody just came. When they're ready to whatever, somebody came in and said she is right. And they had to change it back. So all
Good.
of that money was paid. Most of the money, apart from my out of pocket, was paid by that. And who but God?
That's God.
Who but
That's
God
God. That's
could
God.
make that? I mean, I fought with them for almost a year, and every time it's the same foolishness. It's the same foolishness because they put the wrong date on the card. And like I'm saying, every time, and I, like this person is telling me one thing, and I said X said so and so, it can't be. And they go print something, and they give me to read, and they this and they that, and the foolishness. And somebody just walked in and said, just by chance, and said she is right.
The grace of God. That is, Irene, you have taught us so much, and I know I'm speaking for the viewers when I say to you that I am so thankful for you sharing your journey and sharing so authentically. And I would like to give you an open invitation whenever you feel like coming back. I would love for you to come back and share, because when you hear a story firsthand from someone who wants to help others, it makes such a difference. And I can tell you that, like I said, your episode was the most phone calls that I received, because I mean, because most of us, we're not in our 20s anymore. You have us thinking. I'm serious. You have us thinking.
Bree, one of the things that I've come to realize, sickness is nothing that you go out and buy,
True.
you know, and knowledge is power. Knowledge is
Yes.
power. To have somebody who is going to tell you, when I talk about this, listen, because I've been there, done that. I live it on a daily basis.
Yes.
I
Yes.
live it on a daily basis. And, when I see where I'm coming from and all the things that have happened, that could just blow your mind.
Yes.
Could just blow. That can happen to somebody. Yes, it can.
I tell you, I've learned so much from you. And, I'd like to ask you to please share your closing thoughts with the viewers. And to the viewers, if those of you who will watch the replay, feel free to share your comments on how you feel about this episode. Did it make a difference in your life? Did it get you thinking? Because, many of us, as we get older, the reality of life kicks in. It's like when you're younger, you think you're going to live forever. You think you're invincible. And I'm 60 years old, and I tell you, I see life so differently now. And, you know, Irene, everything that you shared, even tonight, about the whole process of your transplant, I had to think about the people in Jamaica that don't have, you know, because you said it before in the last episode, if you were living in Jamaica, I mean, what did you say? I'll have you say it again.
I would be dead, Brie. There's no two way about it. You know, there is no two. And when I lived in Jamaica, I had a bit of a edge in the sense that my brother-in-law was at UA, and he was a doctor at UA. So, being a doctor, having whatever, he's the person that could send a helicopter for you in Portland and you could come to Kingston, and you would be fine because, he worked at university for some 20 odd years.
Yeah.
So like if you're to see a doctor immediately, he can pull some strings and get you to a specialist within reasonable time, quickly, whatever. He will give you advice. He knows where you are to go, what to do. He died, unfortunately, and that is no longer there. The fact that I have three sisters who are nurses, one of them is in education, nursing education, so she teaches the nurses the that are already nurses, you know. So one is a midwife, and another one is a pediatric trach patient nurse. So two are special. Well, all three are specialists. But the people I have met in my journey, it's like, God put them there for a reason. So you're gonna go and meet somebody, you're gonna somebody was looking after me, is my sister's friend in the hospital. Somebody I taught was a nurse there. Just people within every scope of life. My doctor was there every single day. My nephrologist was there every single day. So it's like the things you do sometimes. God prepares you in a special. I could not have asked. I did my surgery at Memorial, and the people at Memorial, they are like family. I tell you, they are like family. You walk in, and everybody, I've been with them for so long that everybody there knows me. Every
Yeah.
single soul within the unit knows me. Um, my closing thoughts would be for us to take responsibility. If I don't think I could be at fault for whatever happened to me, but things happen. And like I'm saying, if you do not take responsibility for yourself, nobody is going to. And another thing I've come to understand, the cost involved is exorbitant. And knock wood, I had the means. What about the person who doesn't?
Yes.
Knock wood, I have the means. I had the means and I can survive. I can survive. One of the things, do I miss teaching? Of course. I did so well at my job that, you know, I had at one point, Brie, I had a 98% pass rate.
Wow, that's excellent.
A 98% pass rate. Yes, but sometimes too, I believe that God slows us down when we're moving too fast. I miss work, but I get the chance to sleep all day if I want to now.
Yes.
You know, so that I know the people God has put in my life are there for a reason, and the fact that they are, it's sometimes it is in the tragedies that God shows you who people are. You know, people will will just turn up and let me take you here, let me take you there. I remember when after I did the surgery, Brie, I'm so accustomed to get up and do this and do that, and I just couldn't manage. And I said, like my sister was here one day, and I said, I want to go to the supermarket.
Yes.
I just want to go to the supermarket to pick up a few things to walk around because
Yes.
those are the things. I still want to go shopping.
Yes.
I still go shopping. You know, my husband will say, "Come, the nails need to go do, or you need to go get a pedicure, or you need to go get a massage someplace, or a facial, or what have you," because you're just sitting down at home. Because you're just sitting down at home doesn't mean that life is over.
Right. Right. That is so true. Mikey says this episode is a thriller for me. Thank you, Irene, for sharing your personal journey through sickness and health. May God continue to bless and strengthen you all day. Blessings up. Thank you for saying that,
That
Mikey.
is
And
so sweet.
Joyce, we're about to end, but I'm hoping that you'll watch the replay. You know, Irene, you shared a lot of knowledge with us, and I'd like to say to the viewers, Irene has done her part. Now it's up to us to do our part. She's given us the knowledge, but I've always said knowledge without application, it's dead. Now we have to apply this knowledge to our lives. We have to share this information. Irene, God bless you for all that you have shared in these past two episodes. And like I said, you are welcome to come back. Just reach out to me and tell me, hey Bree, I'm ready to come back. I will have you back anytime.
Whenever
And
you want, we did, I don't have a problem doing this for the
I
viewers and for you.
thank you.
Any day you
Thank
want me back,
you.
I'm ready.
Thank you so much. And Lucille is asking Stephanie, she was saying her name sounds so very familiar. And you probably, because she was also a teacher at Titchfield. So
I
I'm pretty
taught
sure
at
you know
Titchfield
her.
for 20 something years.
Yeah, she taught
So
at
anybody has
Titchfield.
connection with Titchfield know who I am.
Yes, yes. So yeah, so I tell you, thank you to all the viewers who joined us for this two-part podcast. And like I said, please feel free to share it. It's also on YouTube. And, I am really looking forward to having Irene back. So please feel free, like I said, to comment how you felt about these two episodes, if you learned anything, and how this episode has changed your life. Take care, everyone. God bless. Irene, thank you so much. And I look forward to having you back soon.
You're welcome, Brie,
Good night.
anytime.
God bless.
Take care.